Parents, this video is for you if your kiddo is struggling with a tongue tie or you think it might be the cause of their distress. Tongue ties can cause difficulty latching, not getting full, so it feels like your baby's always hungry. Maybe they're not gaining weight. Maybe there's a little clicking sound when they do try to nurse or try to feed. And one of the biggest challenges as a new parent is figuring out, is it a tongue tie or is it something else? I know myself as a new dad, my son Mason, he had a posterior tongue tie and he had this little, they called it an Eiffel Tower shape at the front of his frenulum. And it was tough because he was having trouble nursing, and as new parents, that's all we wanted, is for him to be fed and to feel comfortable in his body. So it's something that I would love to support you in your journey in figuring this out as well. You might have heard the term tethered oral tissues, TOTS. That's another phrase people use when talking about tongue ties. And the thing that it can be difficult to tell, is it that or something else, is because it can mimic things like colic, or maybe your baby, there's something wrong with their digestion, it's not working the way it should, and that can mimic symptoms of tongue ties as well. I'll talk about what we see in our office that also can be contributing to the problem, because if you've looked this up, if you've talked to your pediatrician, you've probably heard of a genetic component like the MTHFR gene. It has to do with folate levels, maybe too much folate, too little folate. If there's too much, that's a potential thing that some studies have shown can contribute to extra tissue forming if there's too much prenatally. So while those are components, what my expertise is as a pediatric chiropractor is the nervous system. So I want to share how that can tie in to your child's difficulty, and as a parent myself, what you can do to help your child, because ultimately that's what we want for our kiddos. So when it comes to a tongue tie, it has to do with their ability to move their tongue, to move their jaw, to be able to get a good latch. And in order to do those things, all the muscles of the mouth, the tongue, the face, even through the neck, the jaw, all the way through this area have to be engaged and moving properly. What we see in our office is there are times where the tie is so severe, so restricted, that's like the obvious answer. You've got to get it revised, got to get it cut, and move forward from there. However, there's a lot of times in our office where we see this range where there's something going on, but you might talk to one lactation consultant and they say, don't worry about it. You might talk to another and they say, you have to get it revised for sure. And maybe you visit your pediatric dentist and they say, yeah, we could do it now, we could wait and see. And that's where the confusion can come in. So in order for your baby to have a good latch, to do what they're supposed to do, they need relaxed muscles through this area. One thing that we see can cause increased stress in the nervous system, which controls the muscles. If you think of yourself, if you've ever had a stressful day and you feel that tension creeping in your shoulders, it's because your brain sends messages through your nerves to tell your shoulders, we're under stress, better tense up. So for a baby, sometimes we see a stressful pregnancy for mom. Maybe there were challenges with conception and fertility. Maybe in my wife's example, she had some things she was just trying to get done for work so she could take time off. So she was working extra hard leading up to labor and delivery. So stress early on in mom's system is also shared with baby's system. That umbilical cord that we know carries the blood supply also carries the nerve supply. So stress nervous system for mom can start to create stress in baby's nervous system as well, and that tension can start to creep in. The other big factor, the second one that we see that can contribute, is labor and delivery. So when baby is born, we know the head and neck are the most vulnerable. When we pass baby to grandma or little nephew or niece or cousin, we always say, make sure you hold the neck, make sure you hold the head. And during labor and delivery, especially if there's something like forceps or vacuum or manual assistance where baby's getting a little bit stuck and doc needs to reach in and help pull baby out, that can add a lot of stress to this area. Things like C-section, even induction, can sometimes start contractions before baby's ready and make the neck and the shoulders more vulnerable. So if we see those areas thrown off from labor and delivery, those will affect the nerve supply that leaves the neck and controls and coordinates all the muscles in the face, the jaw, the tongue, the cheeks, the lips. So if we see that stress built up in the nervous system or something off stressing these muscles, what that's going to do is limit baby's ability to nurse and to latch. So what we find is in that realm of tongue ties where you're not quite sure, do they need a revision or not? What we always recommend doing is starting more conservatively by freeing up with our neurological chiropractic care, freeing up that nerve flow to those muscles so things can start to relax and have the movement and the mobility to function as best they can. What we can then decide together is maybe that frees things up, baby starts nursing, they're gaining weight, you feel like they have a good latch, they're feeling comfortable and full after feeding, and you say, all right, I think we got to the root of the problem. If we do that and you start to see, yep, things are freeing up, I feel my baby's more content, more relaxed, but something doesn't feel quite right, then you know that the revision is probably a good next step. So that in my son's case, we actually end up getting it revised because of the severity of it. And then we used chiropractic not only to support his body going into it, but then to help recover afterward. And that we were just actually last week at the dentist, and she was checking on some of his movement and mobility, and she was just commenting how she wishes that anytime a kiddo did have a tongue tie revised, that there was better protocol to help them really continue to free up everything behind the scenes. Because if all that is done is releasing that tongue tie, but that tension is staying in your kiddo's system, it's going to still limit that mobility and ability to get good results and the results that you're looking for. So reach out if you have any questions. We are always here to help you out and guide you in the parenting journey, which I know for myself is not always easy, but it sure is rewarding, and we want to be here for you as well. Take care.